Hello, hello, YouTube world. I'm tuning in about a minute late. Sorry, guys. I have had a heck of a day. Um, all right. So, as you guys filter in, I'm Miss Patty with 4 Year CNA. Thanks for joining us for today's live question and answer session where I show up to answer all of your questions about CNA training, CNA testing, the workplace, and life in general. Anything I can do to help, I'm here. Hi, Jennifer. Thanks for coming. Today's lesson is all about you, actually. So this is going to be really cool. Let me just pull the chat out here so you guys can see. That way I can see the questions. And as you guys come in, make sure you give me a quick wave or a hello. That way I know you're here. We got a couple people joining us. I got to get this situated. There's so many windows open here. Hold on one second, guys. And we'll be all set to go. All right. So I think we're set up here. Okay. So hi, Fatal. Hi. Nice of you to join us. It's raining here. I'm in Florida. We're finally getting some rain. We need it desperately. So I'm super excited about that. But hopefully my internet will remain stable because I had some problems this morning with the internet. So if we go down, as soon as I'm able to, I'll come right back up. Just kind of bear with me. But the weather is a little bit not cooperating today. All right. So Jennifer last week and a couple weeks ago asked about diabetes, and I told her that I would have a lesson for her, and I had to put it off. But today we're going to learn about diabetes. Now, this is going to be a super short lesson. Understand that diabetes is a huge topic that people can spend years and years and years researching and learning about. It's way more complex than I'm about to make it. I'm really going to simplify this for you and give you kind of a general overview of what happens in the body with diabetes. And hi, Worry Girl. Hi, Tiffany. And why diabetics tend to crave sweets. There's actually a reason behind it. It's not just that, they're, addicted to sweets or that they can control it or whatever. So I'm going to explain this to you. Now, after last week, I do want to tell you this real quick. After last week, I actually went out and bought a kit to make crystals to show you how this works. Unfortunately, my crystal growing kit is still in process. It's not really grown enough for you guys to see. That's going to be important a little bit in a few minutes, and I'll explain why. But I did an experiment to show you, but it hasn't cooked quite enough yet. So next week, I'll actually show you the crystals as they're growing. They're on my windowsill over here because they have to have light to grow. And they're just not quite ready. But I did an experiment specifically to show you guys this. So that was kind of fun. All right. So what is diabetes and why do we even care? Hi, Ida. Hi, Gloria. And Gilo and Football Arena. Hi. Okay. So so right now we're going to talk about normal metabolism. Okay. Normal metabolism. So this is somebody without diabetes, just somebody that, everything is working fine. So when you eat carbs, and examples of carbs, we call it the rule of white. If it's white, look at it pretty closely because it's probably a carb. So carbs would be like bread, pasta, potatoes, flour, anything made with flour, like gravies or things like that. Sugar and anything made with sugar. So cookies and sweets, and sugar hides in a lot of places too that we don't really think about, like ketchup has sugar in it. A lot of spaghetti sauces have sugar in it. So hidden sugars play a part in this. And even fruit has sugar in it. It's a naturally occurring sugar called fructose, but it is still a sugar. So when you take carbs into your body, so flour, sugar, and pretty much everything white except for cauliflower, when you take carbs into your body, they break down, become sugars, and then those sugar molecules enter your cells and create fuel, because every cell in your body actually needs fuel to run. And sugar is a great source of fuel for every cell in your body. So in our society, carbs get a really bad rap, and they're not bad. This is the one thing I need you to understand. Carbs themselves are not bad guys. They aren't. carbs in excess are bad. Okay, but carbs themselves are actually good because your cells need the fuel that they provide. And that fuel comes in the form of sugar. But the sugar, so you eat carbs, they break down in your body into sugar molecules, and those molecules go into the cells. But the sugar can't get into the cell all by itself because the cells have a door and the door is locked. So, in order for that cell door to get unlocked, we need a key. Now, luckily for us, we actually have a key factory right on board, built in, and it's called the pancreas. So when you eat carbs, they break down into sugar. The brain says, hey, we need some keys. The pancreas says, on it, and creates some keys and puts them in the bloodstream. Now, we have keys to unlock the door, and we have sugar to enter the cell, and everybody is happy. Okay. Now, the cells will only use so much, right? After they get saturated, after there's enough energy inside the cell, there's no more room for any more sugar to get shoved in there. So that sugar is going to circulate around and around and around and around. Now, the one thing you need to understand about sugar is that it doesn't get excreted. So, like if you take in too much vitamin C, your body's going to get rid of whatever it doesn't use. So it uses what it needs and gets rid of the rest. If you take in too much water, your body uses what it needs and gets rid of the rest. So we're really good at utilizing nutrients and then excreting what we don't use, except for sugar. Sugar doesn't follow that pathway. It's very, very difficult to excrete it because they're crystals. Remember I said I did a crystal experiment, right? So you could see. So I have this little rock here to kind of show you. But if you look closely, I don't know, man, that is like really blurry. Okay. If you look kind of close at this, you can see the crystals. That's still really blurry. It's not a very good camera, guys. You can see the crystals in here, and they're kind of sharp, jagged edges, right? So this is a big version of a sugar crystal. Okay, so think of this like a sugar crystal magnified a million times, except the edges are actually a little bit sharper than this. So when you have sugar that's not going into the cells and it's just going round and round and round and round and around the body, it's got to go somewhere because you can't excrete it. Now, in late stages of diabetes, you can, because those jagged edges have actually torn up the kidneys, and it's now the kidneys are torn up enough that these things can go through. But generally speaking, sugar doesn't get excreted by normal metabolism. So we got to do something with it, right? If the cells can't use it and we can't excrete it, we got to do something with it. So our body has a system where it packs up all this excess glucose or sugar. It actually converts it into a storage container called glycogen. It's just a process where it takes that glucose and makes it storable. So think of packing it in a box, and then it puts it in a storage container that we call fat cells. So our fat cells are actually holding, that's the whole purpose of them, is to hold excess fuel that we might need later. If we don't get enough fuel from our diet, then we have something that we can unpack later. It's not as efficient. It doesn't work as well because, it's been in storage for a while, but we do have some reserves, right? But eventually, once all of our storage units get full, what do? Right? What do we do? So if you don't use it and you can't store it anymore because all of our storage units are full, now that sugar is going round and round and round and round and round, and it ends up making a mess. Because remember, these are sharp crystals, right? Sharp crystals. So what these do, if you can't use it and you can't store it, right, then it causes problems. So let's talk about diabetes here, right? So we just talked about normal systems. Now we're going to talk about diabetes and what went wrong. So in diabetes, people still eat carbs. That doesn't change. They still break down into sugar. That doesn't change. They still go into the bloodstream. That doesn't change. What changes is our factory that makes the keys is no longer working. Maybe it broke down. Maybe it never worked from day one. Maybe it just got overused and is tired. There are different types of diabetes. We'll talk about that in a minute, but it's not working. So we have sugar molecules, but no keys to get them into the cells, right? So you got all this sugar going round and round. But in the meantime, remember, those cells are hungry. They're starving cells. So your body takes in carbs, breaks down into sugar. Sugar goes into the bloodstream. No keys to get those into the cells. The sugar goes round and round and round and round, and it can't get into the cell. That's what diabetes is. That's why blood sugar levels go higher, because all the sugar is in the bloodstream, not in the cells where it needs to be. Make sense? Good. Okay. So this is why overweight people tend to be prone to develop diabetes, because up until the point that they develop diabetes, they've been packing this excess sugar into their fat cells. But at a certain point, there's just no more room in the storage units for more sugar. So it stays in the bloodstream. This is why overweight people, or people with high BMI, body mass index, tend to develop diabetes, because there's just nowhere for these excess sugar molecules to go. If you can't use it, then you end up circulating it. So what does this do inside the body? Well, these sugar molecules, as they're going through the arteries, so think of arteries as a pipe, okay? Those sugar molecules settle on the inside of the arteries, and they actually make the arteries very stiff. So think of like a cupcake that was made 3 or 4 days ago, and it sat out on the counter for a couple days. You know, the frosting, the sugar frosting, it gets a little crystally and a little bit oily, but it's stiff, right? Have you ever seen frosting that's been left out for a couple days? It gets stiff. That's the same stuff that gets on the inside of your arteries. So the arteries can't expand when we need more blood, like if we have a wound, right? Or they can't contract to reduce the amount of blood. They're kind of stuck in one position, which means that we don't have a whole lot of acclimating power. The other problem with that is because these are crystals and they're sharp, jagged things, that everything that goes by them, right? Because they're on the inside of the arteries, everything that goes by these crystals ends up getting either caught up in the crystals, like cholesterol. Guys, cholesterol looks like pizza cheese in your arteries. If you cut your artery open and looked inside, it would look like pizza cheese, right? So pizza cheese gets all wrapped up in these crystals that are lining the inside of your arteries. And they also will shred cells that go by. Things like red blood cells that bring good, oxygen to your tissues, white blood cells, which helps heal with injuries, platelets, which helps clot things. So you can see that when somebody has diabetes, that we're not going to be able to acclimate because our arteries can't move. They're too stiff. And the blood isn't going to effectively get through the arteries because they start to get all clogged up and gunked up, and stuff just can't flow through very well. So this is how diabetics end up with high blood pressure, because the artery is so filled up with gunk that what's left, the blood that's trying to get through there, right, is going through such a small area that it raises the pressure. So that's why high blood pressure goes along with diabetes. Okay, everybody with me so far? Everybody good? Okay, so when we have diabetes, we have a problem where the sugar stays in the bloodstream, doesn't get into the cells, and that means the cells are starving. Oh my gosh, they're dying, and they're telling the brain, we're dying. We need fuel. We're hungry. We're not getting the energy we need, and we're at risk of dying. So the brain says, "Oh no, I need some quick fuel. I know that cells run on sugar. I know I need to get sugar on board, so I'm going to trigger a craving for something sweet." This is why your diabetic patients often munch on M&Ms or donuts or something like that. Part of it is lifestyle habit, right? Because these are comfort foods for them. But the other part of it is a very real craving triggered by the brain because the cells are dying. And the brain is like, I got to get some, some fuel on board for these cells. So the brain triggers this craving for sweets because it's a quick source of energy. Well, the problem is that when that diabetic patient eats those sweets, right, because their cells are starving, they're doing the right thing, they're getting sugar on board. But what the body doesn't understand, doesn't realize, is that there's already sugar on board. The problem is not getting sugar on board. The problem is getting sugar in the cells. And the brain just doesn't make that translation. The brain doesn't figure that out. It just says cells starving, need sugar, trigger craving. So we get more sugar on board, and that sugar still can't get into the cells. So now we got more sugar going round and round and around the body, and the blood sugar goes up, and we end up with really big problems. Now, this issue of all of this sugar's a crystal. Crystals are heavy, right? Think of this. This is heavy. So these crystals are going to be pulled down because we have gravity on planet Earth, right? So they're going to be pulled down to the lowest areas of the body. So the lowest area of my upper body is my hands. So if I stand back here, you can actually see my hands are low, right? And the lowest point of my lower body are my feet. So hands and feet get affected really, really commonly with diabetic patients. And if we get an injury to the hand or the foot, it may take a lot longer to heal because we can't get good blood there because all those blood vessels are all bound up and we just can't get good blood to the area. I hope that helps you guys. Now, there's a couple of different types of diabetes. The end result is the same. Pancreas is not making insulin, no keys to open the cells. All right. So the end result is the same, but what killed that factory can be different. Type 1 diabetes is when the child is born without a functioning pancreas at all. It just doesn't work from day one, just not working. So that's juvenile diabetes or type 1 diabetes. It means that the body's just not giving us the keys we need. Adult onset diabetes or type 2 diabetes is generally due to a diet problem. And this is really common in America because we have a very carb heavy lifestyle. And this starts in childhood, infancy. So let's think of a 3-year-old child, okay? So a 3-year-old child gets up early in the morning. Mom's not quite ready to get out of bed. So she hands the kid a Pop-Tart while she lays down on the couch and tries to wake up a little bit. Kid munches on a Pop-Tart, watches TV or YouTube or whatever it is they're going to watch. And then mom gets up and makes breakfast for the child. And usually small children don't eat like Raisin Bran cereal, do they? They don't eat Fiber One. They're eating Fruity Pebbles, Tricks, Kicks, all of those really good, fun, fruit flavored, yummy, sugar laden cereals, right? So we started off our day with Pop-Tarts, which are carbs. Then we ended up with breakfast, which is heavy on carbs, right? So so far today, our pancreas has had to push out insulin because we're just overloading with carbs. And then we have a snack in the mid-morning, probably some fruit, which remember I said earlier, fruit has carbs. It has sugar, fructose, which is a natural carb, but it's still a carb. So our pancreas has to work harder to push out insulin. And then we have lunch, which might be like a corn dog or some macaroni and cheese. And those are all carbs. So we push out more insulin. And then we have an afternoon snack, which is probably like a Little Debbie's or an ice cream cone or something like that. And we have carbs on board. So we have to push out insulin. And then we have dinner, which might be spaghetti and a salad, which spaghetti is pasta, more carbs. We have to push out more insulin. And then before bed, we have to have some sort of a dessert, right? Can't send a kid to bed without dessert. So that's going to be a sweet something. So that causes the body to push out more carbs. And before you know it, our pancreas has been working hard all day long without a break. Now, that's a 3-year-old, but that diet tends to continue throughout your life. If you look at your diet really objectively, you'll start to see that you probably take in 3 to 4 times more carbs a day than you do protein. So that means that your pancreas is having to work really, really hard to get enough insulin out there to take care of all of that sugar. And if we do this for 60, 70, 80 years, eventually your pancreas is going to go, I'm out, done. I just cannot do this anymore. You have overused me. I'm done. And that's type 2 diabetes. We've overused our pancreas. We've worn it out. It's no longer active. We're not producing insulin. And that means that all of that sugar we're taking in isn't going into the cells where it belongs. It's just circulating round and round. And remember, that builds up on the inside of the arteries and can prevent blood flow to certain areas. But it gets worse. It gets way worse, because that sugar is not limited to just the inside of the arteries. That sugar actually coats nerves as well. So this ends up with diabetic neuropathy, where patients can have a feeling like pins and needles or ants biting them all the time, usually in their hands or their feet, because the sugar coats the nerves and the signals just can't get through. Or they can end up with an injury and not even know that injury is there, because the signal can't get from the area of injury all the way to the brain, because the nerve that's supposed to take that signal is way too corroded. So this is why diabetes is so dangerous. So if you want, and this is why a lot of your diabetic patients will crave those sweets, because their cells are literally starving. And that's the only thing the brain knows to do. Okay, cells are starving. I got to get some sugar on board to feed the cells, not understanding the sugar is already there. Now, every cell has a back door, right? So the main door is the one that's unlocked by insulin. Sugar goes in, everybody's happy. But every cell has a small back door as well. And that back door is opened by protein. So if you have a patient who's diabetic and you see them eating a handful of M&Ms, don't yell at them. Their body is dying. They're trying to prevent that from happening. It's a legitimate craving. But instead of yelling at them for giving into their, the craving that their cells are dying, try to get them to eat some protein. So if they pair some protein with those carbs, that opens the back door of the cell and some of the sugar can enter. So if you've got somebody who is diabetic and they need a snack, graham crackers with peanut butter is a great option, because you've got the carbs that they're craving, but you've also got the protein that will help those carbs enter the cells. You can have apple with cheese or a half a tuna sandwich. But if you pair that protein with the carbs, it really, really helps. Now, pro tip for anybody that is diabetic, if you can get your carbs down, right, where if you're making a list of everything you're eating, if you're eating half as much protein as you are carbs, it's almost impossible to get your carbs down to equal to protein unless you're on a keto diet. And those are really, really hard to maintain, especially when your brain keeps yelling at you, I'm dying, right? So if you can at least your goal should be, this is a truly achievable goal for diabetics, is to never eat more than twice as many carbs as you're taking in protein, right? Because that's an achievable goal. Sometimes we set goals that just simply aren't achievable by, normal mortals, right? We all have cravings. We have things we like. We have life. And a lot of people, if you severely restrict their diet, they're just going to give up and eat the way they want to, because there's no way they can keep that up. So a very achievable goal is to add protein in to take the place of some of those carbs. So never eat more than twice as many carbs as you're having protein. Does that make sense? I hope that helps you guys. Okay. So let's go back up here. Let me see. Oh my gosh, look at all these. Okay. Bear with me, guys. All right. So Ida says, late Gloria, just getting out of work. El Mundo says, where you're at, which state. Nurse says, hello, everyone. Hi, Nurse Elma. Brunelli says, hi. Joanna is here from Carlsbad. Worry Girl says, it's late here in Qatar. We do the same CNA exams. It's organized by the American Association. They conduct it. We get the same result. Wow, very good. I did not know that, Worry Girl. Anna Marie says New York. Worry says, I'm glad to let everyone know I passed my CNA exam. Very good. Congratulations. Oh, you're off to bed. You probably didn't hear that. Hopefully you'll get to see the replay and see that. Congratulations, Worry girl. Let's see here. Blue. Hey, Blue. Thanks for joining in. All right, Jennifer. A nurse told me that overweight people are more prone to diabetes because it's the pancreas is tired of making extra insulin for a bigger body. Yes, but it has more to do with the diet because they've taken in a lot of carbs and it just wore the pancreas out. And I mean, it does have something to do with the larger body size, but it's more a lifetime of eating habits that have gotten that pancreas to that point. Nicole says, I did my test Tuesday and I passed. Oh, thank you. Congratulations, Nicole. That is awesome. We are super proud of you. Let's see here. What about if a regular person craves sweets? There isn't enough sugar in their cells either, or does that apply only to diabetes? Well, Jennifer, sweets, there's a whole nother component of this as well, but sweets satisfy a pleasure center in your brain as well. So there's a neurochemical component to craving sweets as well. That's why I said earlier, a lot of times this is a comfort food issue, that's just kind of our comfort zone. So sometimes the sweets, if you have a non-diabetic person craving sweets and their blood sugar levels are stable, it might be more of a neurochemical imbalance that they're just craving those sweets. It could also be a lifestyle too. We get into habits. I love chocolate, the dark chocolate Oreos. Man, those are my favorite. I love those things. And if I have a package of them in the house, I'm going to eat them. My body's going to crave them because, man, they're there and I like them. But that doesn't necessarily mean that there's anything wrong with me. It's just something that I really like. They're available to me. And, my body's like, yes, I want those. Thank you very much. So it may not have anything to do with an imbalance anywhere. It may just simply be a lifestyle. That's really hard to say without further testing. Okay. Wendy, hello. Jacqueline, tomorrow is your test. Oh, how exciting. Good luck to you, Jacqueline. Let us know how you do. Make sure you stop back by and drop me a comment in one of my videos and let me know how you do so we can congratulate you tomorrow. But we wish you tons of luck. We're sending out good vibes your way. Yanalik says, hi. Blue says, with diabetic neuropathy, be careful. You could end up like my hubby. 0 feeling in his feet and in a power chair. He had a hairline fracture in his right foot for 2 years. Yeah, and that can happen. I'll tell you a story about this. Years and years and years ago, when I was an agency nurse, think of agency nurses like substitute nurses. We're not really a part of that facility, but we're filling in for people that aren't there. So agency nurse. And I went in, I was assigned, that was my assignment for the day. I went in and I was checking on a patient, brought him some pills, and I was doing a head to toe assessment, and I found a wound on his foot, and it was very deep. There was a thumbtack that had been in the bottom of his foot. We don't know how long, because he had those slipper socks on, the ones with the little white dots on, so nobody had ever seen it. And he wouldn't let anybody near his feet because he had neuropathy. But he had a thumbtack in the bottom of his foot, and he had an area about this big around that was black, dead tissue. It was a really bad situation. But he did not know that the thumbtack was there. And like I said, we have no idea how long it had been there. So it's possible to have an injury like a hairline fracture for a long time and not even be aware of it. You can be aware of the fact that, you can't walk very well, or, but the pain itself may get overridden by that neuropathy, what I call static. Okay. So neuropathy is kind of like static on the nerve lines. It's just not allowing anything to pass. And ironically, this is actually kind of how TENS units work. I don't know if you guys ever heard of TENS units, but it's an electrical impulse that is designed to basically deactivate a nerve so that the pain signals can't get through, right? That's how a TENS unit works. Well, diabetic neuropathy does the same thing, but not in a productive way. So yes, it is possible, certainly, to have a hairline fracture, and not even be aware of it. I mean, be aware that you can't really walk well, but not be aware that there's an actual fracture there. So that's where diabetes can be very, very dangerous, right? That's why everybody that's walking should have shoes on, because you never know, if you have a diabetic patient and they step on something, they may get injured and never even know about it. Sarah says hello. Yanalek says hello. And Benjamin says, thank you very much. I have exams on Tuesday from New Jersey. Very good. Congratulations. We're super excited for you. You need help on the written test. Well, on my website, I have a free test for your CNA.com under training. There's a practice test there for you. But there's also animated lessons that you need to watch. Those animated lessons will help you get ready for the written test. I promise you. NZ, I passed both written and skills with Prometric. Congratulations. We're super excited. NZ, I'm pretty sure that I congratulated you last week too. I think you were on my list. I recognize the name. So congratulations. We're super excited for you, and welcome to healthcare. Jennifer says, so what is the pancreas's job essentially? To make insulin? Yep. They got one job. There are some other things that the pancreas does kind of in lower levels, but its main job, the main reason it's there, is to make insulin. And that's because every cell in your body needs insulin. So it's kind of an essential organ. Because, imagine what would happen to your brain cells if there's no sugar getting in, right? You're not going to think very well. Your muscle cells, you're not going to be able to go where you need to go. So this is like one of the vitally important organs that you have on your body. And we really should be taking better care of our pancreases. And unfortunately, it's one of those organs that can't really tell you that something is up until it just kind of quits. It doesn't really there's no check engine light for the pancreas. So there's kind of a check engine light for your lungs. If your lungs aren't doing well, you tend to breathe heavy. If your heart isn't working right, it may have a weird rhythm that we can pick up. There's check engine lights that come on that say, hey, pay attention, something's up. The pancreas doesn't really seem to have one of those, though. And that's why your annual checkups with your doctor are so important, because there's a lot of organs in our body that don't let us know that something is really up until it's too late to do anything. And that's why during your normal annual checkups, the doctor's going to draw blood, because they're going to look at your kidneys, your liver, your pancreas, and just make sure that everything is working the way it should. And if not, we'll get some little telltale signs that let us know, hey, something is up here. You need to look a little bit deeper. So don't skip those annual checkups, because if we can find the problem early, a lot of times we've got a lot more opportunities to address it earlier, so we don't get into full-blown organ failure. And we might be able to come up with a solution early. So make sure you're getting those checkups the way that you need it. Okay. Jennifer says, thank you all for this. I really appreciate you. Awesome. So you guys have any other questions about diabetes? You guys have any questions about diabetes? It's really, really important. Now, so let's bring this back around to the test. Okay. None of what I told you is going to be on the test. None of it. They don't expect you to know what diabetes is, how it works, what to expect, nothing like that. But I want you to know these things, because when you go out there beyond the test, you're taking care of patients, and you're taking care of a diabetic patient, and that diabetic patient is craving sweets, right? Instead of arguing with them or trying to restrict them from eating, or, all these things that we think we're supposed to do, right? Adults have the right to make bad decisions. You have the right to make a bad decision if you want to. You can get that large fry from McDonald's, even though you know that it's got more sodium than you need in an entire week. You still have the right to make that bad decision, because McDonald's fries are good, right? So our patients have the right to make bad decisions too. It's not our job to chastise them for that. But if we can help encourage them when you're helping to pick snacks for them, to maybe suggest a protein to go with it. And that way, those cells are happy, they're well fed, they're not dying, which is kind of the whole point. And your cravings will decrease a little bit because remember, the cravings are there because the cells are dying. So if we can keep the cells from dying, the cravings go down, and your diabetic patient will be way, way, way happier with you. You get a lot further with your patients with just a little bit of understanding. But let's translate this to the test, right? So you guys know that during the test, we have foot care as a skill. Well, why would we have foot care as a skill? Well, remember, your diabetic patients may have injuries that they don't even know are there because they can't feel them. So foot care is a skill because it's all about having an opportunity to look at the foot. So you're looking for red areas or sores or wounds or anything that looks funky. That way you can report it to the nurse. That's what foot care is about. It's not about cleaning the foot. You're doing that during showers and other things. It's not about cleaning the foot. It's all about having an opportunity to look at the foot. That's what it's all about. So during the test, when you're doing foot care, you probably should be saying something like, I'm looking at the foot, or there's no abnormalities here, or nothing to report, or, something like that. Hand and nail care. Remember, I said that sugar is a heavy molecule, right? It's a heavy crystal. It's going to be pulled down. So your hands are the lowest part of your upper body. So hands can be affected too. And your patient may have a wound that they're not even really aware of because they can't feel it. So hand and nail care is all about inspecting the hands, but it goes a step further, right? So where is it? I pulled it out. Here it is. So everybody knows what these are, right? Right? Everybody knows what these are. Nail clippers, right? Now, if my nails get long like this, you see that? That's a long nail. I don't want my nails that long because I might hurt my patients. So if I want to limit the size of my nails, I have to use one of these because they're already long, right? So I'm going to use a clipper. I'm going to clip off the nail, file the rough edges, and that's good. But if I'm using one of these guys, there's a chance that I might actually clip the skin. And now we've got a wound. And remember, wounds on the hands and feet may not heal very well because the arteries are so clogged up. So we want to prevent using this. So if we do hand and nail care every single week on our patients, and instead of using this to get our nails down to a shorter length, we use one of these to keep our nails at a shorter length. Just file them every week and you never ever have to trim them, right? So this is preventive maintenance and it doesn't hurt the patient. This could certainly hurt the patient because it's sharp. It's a cutting instrument, and that could cause the patient not to heal. So hand and nail care, that's why we do it, is to help prevent us from having to trim nails. Preventative maintenance, right? So understanding these things as they apply to the test is pretty important. But it goes a step further than that. One of our principles is when our patients' feet hit the floor, we talk about their shoes. You should not be walking a patient without shoes. Slipper socks are not enough because if there's anything on that ground that injures their feet, and guys, in healthcare, we have sharp objects everywhere. We have syringes, we have scalpels, we have needles, we have lancets, we have glass vials that we literally pop the top of, and little shards of glass go everywhere. So we've got sharp objects in healthcare. So we should not be walking patients, especially diabetic patients, without something solid on the bottom of their feet to help prevent injuries. So if you're walking a patient without shoes, I want you to think to yourself, would I let an infant, a small child, walk on this floor without shoes? And immediately your initial reaction is like, no, there's all kinds of germs. Well, if you wouldn't let a child walk there, don't let an adult walk there without shoes either. So slipper socks are not enough, right? So when our patients' feet hit the floor, we have to talk about their shoes, and that's a testing principle. So this really does relate to testing. You don't have to understand diabetes or how it works, although I think it's helpful for you to do so. But you really do need to understand those principles and how they apply to the test. I hope that helps. Queen Stella says, "Hi, Nurse Patty. I passed my BLS exam. Very good. Oh, I'm so excited for you. I told you BLS is not something to really stress over. I'm super happy for you. You never know when you might need to use it." Jennifer says the pancreas will shoot out insulin when the blood sugar is too high. Well, yeah, kind of, but okay. So, like I said in the beginning of this is a subject that you literally could devote years and years of your life to. Okay, so I'm trying to simplify it to a very basic level. But yes, when your blood sugar is high, your pancreas does try to intervene, but that's not really its main goal. The main thing is when you eat carbs and your body breaks them down into sugars, that's what actually triggers the pancreas, is during that conversion process. It's not that we wait until the blood sugar gets high to dump insulin. It's that the insulin gets put into the bloodstream at the same time the sugar does, so that it can open the cells and we never get that high level. Otherwise, our body would have highs and lows, and you'd be bouncing up and down, up and down, up and down. The whole goal is to keep that nice, steady level. And that's why the pancreas produces the keys when your body converts the carbs into sugar and puts it out. Okay. Let's see. Blue says, what are some subtle signs you could look out for high, low blood sugar? Oh my goodness. Okay. So here we go. The symptoms of high blood sugar and low blood sugar are often very, very similar. And you never, ever, ever treat blood sugar until you've actually checked the level. So if you've got somebody who has symptoms and you think, oh my gosh, they have low blood sugar, and you put more sugar into them and they actually have high, you can seriously injure the patient. So you never, ever treat high or low until you've checked the level itself. Okay. That's a nursing principle. But some symptoms are dizziness, wooziness, confusion, shaking, hot dry skin, or cold clammy skin. Some people go either way. The symptoms can be a little bit different in different people too. Okay. But in general, if your patient looks at all funny, at all, if they're red in the face or they're pale, report it. If they're cold and clammy or hot and dry, report it. If they're confused and they aren't normally confused, report it. Or if they're normally confused, but today they're really out there, report it. So anything you see in the patient that's unusual, report it. But there's 3 hallmark signs that we always look at: increase in hunger, increase in thirst, and increase in urination are kind of our 3 hallmark signs. And CNAs are like in the ideal situation to be able to identify that, right? If you've got a patient who just left breakfast and they're still really hungry and they're asking for snacks, and you just can't seem to get enough into them, and they're drinking like there's no tomorrow. And of course, when you drink a lot, then you got to pee a lot. So it's your body's way of trying to dilute the amount of sugar that's in the bloodstream. So report those signs to the nurse. Okay. And Gilo says, thank you. Tiffany says it's a great topic. Thank you. Blue says, I know in Washington state, a CNA can't trim a diabetic's toenails because they might trim the nails too short and cause an infection. We're taught to send the patient to the podiatrist in that case. Yes, absolutely. And in most states, CNAs are not allowed to touch nail clippers. They're advanced pieces of medical machinery you should not be touching. Podiatrists usually take care of toenails. Absolutely. Let's see here. Jennifer says, where I work, if people's blood sugars are too high, the nurse will give them insulin. Yeah, and that can help kind of force that. It can force the sugar into the cells, but it's kind of like So let me use an analogy for you. Okay. Let's say I have a horse and I have a barn. If the horse gets out of the barn, right? If I leave the door open, the horse gets out of the barn. I have to go get the horse and bring them back and then close the door. Yeah, but that's a whole lot more work, right? So when we have blood sugar levels that are high, okay, it's like we let the horse out of the barn. Now we got to go get the horse. So we got to give insulin and then we got to bring the horse back and then lock the gate. It's a whole lot more work and it's not nearly as effective because we don't know what that horse got into while it was out, right? So it leaves the opportunity for many more problems to come in. So when the blood sugar is high, yes, we can get insulin that kind of brings the horse back into the barn, but it's not ideal. Ideal is to keep that patient at a nice steady level. Okay. Does that help? That's why pairing protein with carbs is a really good idea. It can help keep that blood sugar level from going sky high because you're addressing the problem when it's occurring, not after. Okay. Hope that helps. I know this is a really, really, really complex subject. Guys, it takes diabetic educators years of study to get to where they really, truly understand this. But so what I gave you today is just a really, really, really condensed, super simple version of this. But I think it may help you kind of understand the bigger picture here and how you can make changes in your life right now to help reduce the amount of carbs you eat that helps reduce the amount of work your pancreas has to do in producing insulin and maybe prevent yourself from developing this problem later on down the road. It can also help you relate to your diabetic patients as well. You know, one of my favorite ones was a little old lady. Her name was, well, we'll call her Mildred. She had a bag of M&Ms under her pillow, like inside the pillowcase, right? So you could hear it when she laid down. You could hear the bag crinkling. You could hear the M&Ms clinking around. And it was hilarious because everybody knew it was there. She wasn't really hiding it from anybody. But I got her to agree that every time, because patients have rights, right? If she were at home, in her own home, she would be eating M&Ms. We can tell her not to all day long, but that doesn't help. That does not help her cravings. Telling somebody you can't do that does not help. Let's give them a solution. So I got her to agree to start eating protein with the M&Ms. And sure enough, over about a 3-week period, her M&M usage dropped. And she stopped keeping M&Ms in her pillowcase because her body wasn't complaining to her so much because she was keeping her blood sugars levels at a more consistent level. And it really helped. But more importantly, she then trusted me as a caregiver, as a nurse, because I wasn't so busy berating her that I took the time to help her overcome her problem and provide a solution. And I think that we can do a better job as caregivers, right? By helping people solve the problem rather than lecturing them on what they're doing. I hope that helps. Um, let's see here. Even diabetic experts fuss over the best price. Yes, you're right, Jen, or you're right, Blue. Yeah, I tell you what, you ask 5 nurses about something, you'll get 10 opinions. I guarantee it. Jennifer says, so insulin is just there to help, not a permanent solution. You're right, Jennifer. It's not a permanent solution. And what we're trying to do, if we've got somebody whose pancreas is not working at all and they're on insulin injections, what we're trying to do is put that insulin in at the same time that we're putting food in. So we're just kind of cutting the pancreas out of the equation. And that's why we generally give insulin around food times. Yes, Jennifer, maintenance of blood sugars, best way to go. You never want those highs and lows. Yep. And, oh, good. You guys are neighbors. That's awesome. Okay, guys, this went a little bit long. I'm sorry. We're at 50 minutes now. So I will, I'm going to congratulate those that need to be congratulated this week. We got several. So the people that passed this week that stopped by our channel to let us know. And if you're testing soon and you want me to congratulate you as well, make sure you stop by my channel, leave a comment on any of my videos. Just put a comment on the actual video, not on somebody else's comment. Don't reply, because I don't always see those. It has to be a fresh new comment on my video. So if you want me to congratulate you, make sure you drop by, let us know that that you passed your test, and we'll be happy to congratulate you as well. So this week we have Abigail Goddard. Congratulations. Vivian Akpalobi. I hope I said that right. Congratulations to you as well. Welcome to healthcare. Balin LaQ. Congratulations. You passed the state exam this week. Esther Choey. Congratulations. You did a great job. Milagro Segura came by to let us know that she passed her clinicals, still has to do the written, but congratulations on passing the clinicals. We're super proud of you. Kayla Olivares passed this week, and Queen N stopped by to let us know that she passed as well. So congratulations to all of you. Great job. We're super, super excited. And Marva is testing on 3/29, asked us to give her good wishes. So guys, send out your best vibes for Marva. And we're waiting to hear from 2 other people. Artiste Adalov is testing today. So Artiste, if you hear this, make sure you come back and let us know how you did. And Vanessa W. Lopez tested yesterday, and we're dying to know how you did. So hopefully you did well and you passed, and we would love to congratulate you and welcome you into healthcare. BS let us know that they were hired in telemetry in Montana. So they went to work in a hospital in the telemetry unit in Montana, and we want to send them congratulations. Great job. We're super, super proud of you. And you guys all did a great, great job this week. So next week, come back and join us. We'll be here on Thursday at 3, just like we are every week, where I'll answer your questions and give you a little bit of a mini lesson. I know this week was a long lesson. It took up a lot of our time. I didn't get to a whole lot of questions, but bring your questions next week. We'll be happy to let you know. We are one step closer on the card game, guys. I'm super excited about this. I'm sending it off to the printers this week. Just had it proofed. It looks like it's good to go. So stay tuned for more information on that. Man, that is going to be a really, really fun thing. And I'll kind of deal you guys in a hand once I get my proof back. So stay tuned for that. So let's see here. Benjamin has one final question. How about CNA travel? Well, Benjamin, unfortunately, my time is up today. I don't have time to answer that. That's actually going to be a really long lesson. So I'm going to put you down for next week. So Benjamin's question is what's going to start us off next week on CNA travel. So stay tuned. All right, guys. Bye, Gilo or Hilo. You guys have a fantastic weekend. And until next time, happy caregiving.